Hello everyone, Vanakkam and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And we are discussing about Jipmer question paper. In the continuation of that, today we are going to see the part 3. How we are going to discuss? See, we are going to discuss the question along with the 4 options. Each and every options rational we are going to discuss in detail. So it will be definitely so much useful for you guys. So listen to the videos, watch the video carefully until the end. And already part 1 and part 2 is there in the Meteor Nursing Academy YouTube channel. Please go to the channel and watch those videos also. It will be surely helpful for you for appearing in the Jipmer as well as PGI exams. So let's begin the session, and if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. So follow us in Meteor Nursing Academy YouTube channel. Two separate uterus with single cervix and vagina. This condition is called as bicornuate uterus, unicornuate uterus, arcuate uterus, or none. So these are all the 4 options they have given here. You have to understand the question very carefully in order to solve this question. They clearly mentioned two separate uterus is present. Two separate uterus is present. And single cervix and vagina means one cervix and one vagina. So this condition is called as bicornuate uterus. What uterus? Bicornuate uterus. Why I have selected this option? What is the rationale behind that? Okay, so bicornuate uterus means two uterus will be present in the top. You can see very clearly in this image. Bicornuate. This is bicornuate. You can see the first uterus and second uterus. One cervix will be present here, and below the cervix one vagina will be present. Okay, first 1 and 2 uterus is present. Below that one cervix and one vagina. Okay, see how I have divided this. First you should know the normal uterus. See, the normal uterus, it will be like this. This is the, you can see here. Yes, this is the fundus. Okay, and these two are fallopian tubes, and below the uterus you can see the cervix and vagina. Okay, so why I am drawing this diagram, you have to concentrate on the fundus. Okay, the fundus is protruded in the normal uterus, whereas in the diseased uterus, what will happen, the fundus will have an indentation. What the fundus will be having? The fundus will be having an indentation. What is the meaning of indentation? Let's see with this bicornuate uterus as an example. In bicornuate uterus, what is happening, the fundus is indented like this. Fundus is indented like this. Okay, see, this fundus is separating the uterus. Okay, so one uterus, second uterus, and this is the cervix, and below that vagina will be present. Okay, so this condition is called as what? Bicornuate uterus. It is also called as heart-shaped uterus. It is also called as what? Heart shape, because you can see a heart shape here, so it is called as heart-shaped uterus. Okay, and the second type what we are going to discuss is didelphys uterus. What is that? Didelphys. Okay, so here in didelphys, how the uterus is going to be? Di means two. See the image carefully so that it will be easy for you to understand. Okay, so in the previous one, in bicornuate, it is a heart shape like this. Okay, but here narrow straight indentation will be there. Narrow straight indentation will be there, and the indentation will be extend to the cervix also. The indentation will extend to the cervix also. For example, here you can see 1 and 2 uterus. So 2 uterus is present. Even the cervix is also divided into 1 and 2. So 2 uterus and 2 cervix and 1 vagina will be there. How many uterus, how many cervix, how many vagina? You can see 2 uterus, 2 cervix, and one vagina will be present in the didelphous uterus. This is the characteristics of the didelphous uterus. Okay, and the next one, what we are going to see? We are going to see the unicornuate uterus. What is that? Unicornuate. In unicornuate uterus, what is happening? Only one of the uterus will be present. Only one of, for example, this is the fundus. Okay, and that's all. The uterus will be like this. Okay, so one fallopian tube you can see. Okay, and one fundus you can see. And this is the uterus, one uterus, and followed by that one cervix and one vagina. So the one part of the uterus will be present, another part is absent. Another part is absent. So this condition is called as what? Unicornuate uterus. And the next one, what we are going to see is arcuate uterus. Okay, see, arcuate uterus is almost a normal type of uterus. You can see a small dent. Arcuate uterus. You can see a small dent over the fundus. That's all. Okay, you can see a small dent, right? So this condition is called as what? Arcuate uterus. Okay, the next very important thing is septate uterus. What is that? Septate uterus. See, again there is a big separation. A wall will be present in between the uterus. You can see this is the fundus. Okay, and this is the uterus. Okay, and this is the cervix, vagina. You can see a separate wall in between the uterus. Okay, and this septum, this wall is dividing the uterus into two parts. First part and second part. Okay, so and this one will extend up to the cervix, or sometime it will extend up to the vagina also. So if septum is present, what is present? If septum is present or wall is present in between the two uterus, then it is called as what? Septate uterus. And indication for ECT is, ECT means electroconvulsive therapy. And what is the indication for that? 4 options they have given here: delirium, dementia, major depressive disorder, and OCD. And here the right answer is option C, that is major depressive disorder. Why I have selected this option? See, the main indication for ECT is two things. The first one we already know, major depression, and second one is the person who is having suicidal intention or suicidal thoughts. So these are all the main two indications for ECT. Apart from that, there are many golden points which will be so much related for the exams. We are going to see that. The golden points are related to ECT, electroconvulsive therapy. So the first golden point we already saw, that is the indication. Major depressive disorder, we are using the ECT, and also the person who is having severe suicidal thoughts, we are using this ECT. And second golden point is which anesthetic agent, which anesthetic agent we are using during the ECT. And the name of the anesthetic agent is methotrexate, methotrexate. Okay, so this is the first anesthetic agent, and the second anesthetic agent is propofol. Why we are using this type of anesthetic agent? Because it has a rapid onset and short recovery time. Short recovery time means the person will recover very fast. Okay, so that's why we are using these types of anesthetic agent. And the third golden point is which muscle relaxant we will be using here. We are using succinylcholine as a muscle relaxant. Okay, and the fourth golden point is whether you will use atropine during the ECT. Yes, we will be using the atropine during ECT. Why? The atropine will prevent the bradycardia, because we are using muscle relaxant, anesthetic agent. There is a chances for bradycardia if there is an history for the patient. So atropine, it will prevent the bradycardia, and also it decreases the respiratory secretions. It decreases the secretions in the respiratory tract. That's why we are using the atropine for the patient during ECT. Okay, fine. The fourth golden point is, if you are using atropine, which antidote has to be kept ready for atropine? The antidote for atropine is pilocarpine. Pilocarpine or also pysostigmine. Pysostigmine. Okay, this antidote has to be kept ready. And the next one is, how many electrodes you will be used during the ECT? Used during the ECT. 2 electrodes. If it is a bilateral, 2 electrodes will be using. And the common question which asked many times is, what is the voltage during the ECT? What is the voltage? And the voltage will be 70 to 120 volt. 70 to 120 volt. And the next golden point is, what is the duration? What is the duration for ECT? 0.7 to 1.5 seconds. Okay, maximum how many number of time we can give this electroconvulsive therapy? 6 to 10, some book says 6 to 12 times we can give this ECT, electroconvulsive therapy. So these are all the golden points which is related to the ECT. And what are all the other options? Delirium and dementia. So what is delirium and what is dementia? Here you can see delirium, okay, and here you can see dementia. Fine. Okay, the first important point is, the delirium, it has an abrupt onset. Abrupt means sudden onset, whereas dementia, it has a gradual onset. Slowly it will develop. And next one is, the delirium is reversible. It is reversible, whereas dementia is irreversible. Okay. See, in delirium, disturbance in mental abilities will be there. What are all those mental abilities? Confused thinking will be there, and also decreased awareness towards the environment. Whereas in dementia, unclear thinking will be there. Unclear thinking, followed by that very poor memory. Poor memory will be there. Okay, and the next very important thing is, 3 types of delirium is there. How many types? 3 types. Hyperactive delirium, hypoactive delirium, and mixed type. Okay, so hyperactive, let me give one example so that it will be easy for you. Hallucination. Hallucination is the best example in the hyperactive delirium. Hypoactive delirium, withdrawal, confusion. Withdrawal and confusion. Okay, whereas in mixed type, both hallucination, withdrawal, confusions, delusion, disorientation, everything will be present. Okay, these are all for your additional knowledge. And whereas in dementia, in which disease condition you will be seeing the dementia? This is the golden point. So in which disease condition? The first disease where we can see the dementia is Alzheimer disease. It is caused because of the increasing in the age. Increasing in the age. So what will happen during increasing in the age? The brain cells are become atrophy. Brain cells are going to get what? Atrophy. So the brain cells are going to get atrophy and death will happen. Okay, and the next disease condition where we can see the dementia is Parkinson disease. Which disease? Parkinson disease. You know what will happen in the Parkinson disease? Decreased level of dopamine, increased level of acetylcholine. So imbalanced motor problems will be there. Okay, fine. And the next disease condition where we can see the dementia is, that is Huntington's disease. Huntington's disease. Here also there is a progressive damage to the brain cells. Okay, so these are all the difference between the dementia and delirium. So you all know about the major depressive disorder. There is nothing much to say about that. And the last option is obsessive compulsive disorder. So obsession means continuous unwanted thoughts. Compulsion means because of that unwanted thought, unwanted activity the person is doing, Okay, so that's why it is called as what? Obsessive compulsive disorder. So at the last, the indication for ECT is major depressive disorder. Regular insulin with 50 ml 50% dextrose is the treatment for potassium level 2.5 milliequals per liter, potassium level 7.5 milliequals per liter, serum amylase level none of the above. Usually regular insulin with 50 ml 50% dextrose, it is the treatment for increased level of potassium. Increased level of what? Potassium. How? See, this is the blood vessel and this is the cell. Blood vessel and cell. Okay, so increased level of potassium is present in the cell. If you are administering the regular insulin to the patient, the insulin will take the potassium inside the cells from the blood vessels. See, this is the blood vessel. You can see here. From the blood vessels, here the potassium is present. From the blood vessel, the insulin will take the potassium into the cells so that in the blood vessel, the potassium level will become normal. That is why we are giving the insulin with 50% of dextrose in the for the treatment of potassium hyperkalemia. Okay, why I have not selected the option A? Because here already the potassium level is less. What is the normal potassium level? 3.5 to 5 milli equals per liter. Already here the potassium is less. If you are administering insulin, further hypokalemia will take place. That's why this option is not applicable. Option A is not applicable. What about option C? Here they have mentioned serum amylase level. Usually serum amylase will be seen in acute pancreatitis. Amylase is the one which is used for the metabolism of carbohydrates, right? And this level, amylase level, is commonly seen in acute pancreatitis condition, not in other disorders, and insulin is not required here. Okay, so that's why we selected option B as the right one. You can ask one more question also here. Why the regular insulin is added along with the dextrose? Why it cannot be added along with the normal saline? If the insulin, if it is added with the normal saline, it is also going to take the potassium from the blood vessel into the cell and it will also normalize the potassium value. Yes, obviously you are correct. Okay, but here why we are adding this? If you are giving the insulin, okay, along with the normal saline, obviously it will take the potassium and it will give inside the cell and the potassium level will become normal. At the same time, what will happen? The patient can go for what? Hypoglycemia. Because the insulin not only take the potassium, it will also take the glucose which is there in the blood vessels. The insulin will take the potassium and glucose from the blood vessel into the cells. So the person will go for normal potassium level and also hypoglycemia will be there. What will be there? Hypoglycemia. In order to avoid that, we are adding the insulin along with the dextrose instead of adding in the normal saline. Okay, this is the rationale behind adding the insulin in the dextrose. Okay guys. Identify the image shown below. Here they have given an image and they are asking what is this. It is a very commonly asked question. Many times they have asked this image based question in the exam. This is nothing but laryngeal mask airway. Laryngeal mask airway. So this is one type of supraglottic airway devices. It is mainly used to maintain a patent airway while administering the anesthesia or in case of any life-threatening situation. It is a temporary method of maintaining the patent airway. Okay, so in short it is called as what? LMA, that is laryngeal mask airway. That's all. While administering mannitol, closely monitor the client for hypertension, hypotension, intake output chart and tachycardia. See, first you should know what is mannitol. Mannitol is an osmotic diuretic. What is the indication for mannitol? This is the second golden point. The indication for mannitol is cerebral edema. Cerebral edema. Fine. And the third golden point is what will happen in case of cerebral edema. it will increase the intracranial pressure. And the fourth point is, in case of increase in the intracranial pressure, what will happen? Two signs will happen, that is early sign and late sign. In early sign, headache will be there, blurred vision will be there, vomiting, and pupils are not reacting to the light. Pupils are not reacting to the light because of papillary edema. What about the late sign? Cushing triad will be there. What triad will be there? Cushing triad. What is Cushing triad? Increase in the blood pressure, decrease in the heart rate, and decrease in the respiration will be there. Okay, fine. So here the question is, while administering mannitol, closely monitor the client for, as a nurse, what you supposed to do? You are giving diuretic, what you supposed to do? The question is very simple. You have to monitor the intake and output chart. Okay guys. At birth, which vaccine has to be administered? And here they have given 4 options, that is hepatitis B, covaxin, measles and rotavirus. And here the right answer is option A, hepatitis B. How to solve this question? It is a very simple and direct question. For solving this question, you should know at which time period which vaccine has to be administered. I have selected option A, that is hepatitis B, as a right answer because hepatitis B is administered during the birth. And the second dose of hepatitis B will be administered during 4th week. And third dose of hepatitis B, it will be administered at 8th week. Okay, so this is all about the hepatitis B vaccine. Along with hepatitis B vaccine, they will also administer BCG first dose, and also OPV 0 dose. Okay, so hereby I am ending the session. Part 3 is completed here. Soon we will be uploading the part 4. Already part 1 and part 2 is there in the Meteor Nursing Academy YouTube channel. If you didn't watch those, please watch those. It will be so much useful for you guys for the upcoming Jipmer and PJ exams. And if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Please follow us in Meteor Nursing Academy YouTube channel. Thank you.